You're listening to Who's Tom and Dick, a weekly podcast with your hosts, Martin Weavers, fighting stage 4 lung cancer, and Patrick Mortimer, living with heart disease. Why not grab yourself a cup of coffee, sit back, and enjoy the chatter as we discuss and share information, talking about tough subjects, and offering help, support, and motivation with a positive mental attitude.
Good morning to you, Martin. How are you today?
Good morning to you too. I'm really good at the moment. I've been all my tests and everything, and they've given me the all clear for all my tests results come back fine.
Good. But you're still waiting the scan.
Yeah, waiting on the scan, which I had last week, and I get the results next week. So fingers crossed, we'll have some good news on that. I'm feeling really, really good. But the trouble is, I went in to see Dr. P feeling really, really good, and he told me I'd got 2 lymph nodes growing. So I'm not going to get overconfident.
Let's hope that was just a one-off then, and this time, you'll make some good progress with this new drug.
That caught me by surprise, that did. So, but...
I don't know how you can go into a meeting really either being positive or negative or what. You go into the meeting and you go in how you feel, I suppose, and
well, you can't change the result, can you?
You can't change the result. No, that's exactly right. Anyway, bearing in mind you're on the train. Well, you're not on the train now, but you're travelling all the way down to the Royal Marsden. You thought it would be a good idea to have a chat about the Royal Marsden and the work they do, and some information on the hospital in general.
Well, it's quite interesting because I had some time to kill last week, so I got out a little book, and I'm not going to go on and on, but it just no,
that'll make a change.
Yeah, I know, but some people might like to know about the Royal Marsden. It was opened in 1851 by a guy called Dr. William Marsden, and there wasn't a hospital around like it for cancer research, and his wife got cancer, so he decided that he would build a hospital, and it's now one of the top 5 cancer centres in the world. So that's how big this is. And the Marsden works together with the Royal Institute of Cancer, and it's got the royal approval because the King gave it, which I should mention in a minute. But they've got 2 centres. One's in Chelsea, where I go, and the other one's in Sutton. And they've also got a medical day centre at Kingston Hospital. So, but it's the centre of excellence and research. So I'd love to see where all their little labs are, but I'd never ever be allowed into them. But it's that good. They've treated the King and the King in Waiting's wife as well, Kate Middleton. So that's how big they are. So the Marsden was the first hospital in the world to be completely dedicated to cancer. But anyway, they've moved locations several times, and now they're at their present building. And they was given a £3,000 loan by a lady called Baroness Burdett Coutts, and she actually laid the foundation stone. So, and it was in 1954, that King Edward VII gave it the royal approval. That's what I found out about the Royal Marsden.
Did you know how many patients it treats each year?
I didn't find that little fact out, no.
Well, it treats both NHS and private patients.
Yes, that's right.
And it treats around 50,000 a year.
Wow.
That's a huge number. From what I've found out, they do pioneering treatments and diagnostics. The hospital has adapted advanced technologies, including molecular diagnostics, to help tailor treatments, and MR-Linic, which combines MRI imaging with radiotherapy, linear accelerators, robotic surgical systems, etc., etc.
Well, it's funny you should mention about the MRIs and all that, because they've just got a brand new state-of-the-art machine. And it's different to all the others. It's like supersonic, this one. And when I went up for my scan, I saw a photograph of it, and I thought, that doesn't half look like the one I went through, but I didn't know they'd got a new one at the time. So I'm wondering if I actually did go through it.
Also, it says that in 2023, the Oak Cancer Centre, which is in Sutton, was opened by Prince William. This is a modern treatment and research facility, bringing together many different specialists under one roof to speed up diagnostics, research, and treatment.
So that's probably where they do all the research for it then, isn't it? Because at the Royal Marsden, I go for the first floor for all my visits when I go there to see my oncology team, but the second floor and the third floor full of beds.
Yeah.
And then the fourth floor is the scan. I always think that's the one of the work people with lung disease and all that to go 4 floors. I know they've got a lift. You think they'd put it on an easier floor to get to, wouldn't you?
They have a private care unit as well at the Royal Marsden, apparently.
That's right.
This is a large unit and contributes significantly to the income. For example, in 2022 to 2023, the private care income was 162.3 million.
Wow.
So you're very lucky to be part of that hospital, I think, and the treatment you are receiving.
Dr. P did say that. He said, my first option would be with the treatment I'm having. He said, realistically, I don't think you're going to get on the program. So he said, we'll go for radiation, didn't he?
Yeah. It also says that every week cases are reviewed, and this will be your case as well, by large teams of specialists, including surgeons, oncologists, pathologists, radiotherapists, radiologists, nurses, etc., trying to devise personalised treatment plans for each patient.
Yeah, well, they did that at Bury as well.
So you may nip down for your 10-minute blood test, but in the background, you're being monitored and looked at all the time.
Oh, God, yeah, I know that. And that's why I've not moaned about, having to travel up there, because I don't want to be kicked off this trial.
Do you know the celebrities that have been treated at the Royal Marsden?
Well, I met one on last week, but I don't think I ought to mention his name on here.
No, well, King Charles said be quiet.
Yeah.
I've got a list of a few people that have been treated there.
Oh,
Some of them have been treated there, but their illness has been kept a secret. Obviously, there's cancer.
Yeah.
Otherwise, they wouldn't be there, but they've not given details of what that cancer is. Of course, we talk about King Charles. He's been there. Kate Middleton, very recently, Princess of Wales. She's been there for cancer.
Yeah.
Did you know?
Oh, no, hold on. You're not going to do an impression, are you?
I am your father. I am your father. Any tips?
Oh, Darth Vader.
Yeah, David Prowse has been treated.
Ah.
So Tom Jones has been treated.
Mm-hmm.
Eric Clapton.
Wow.
Bonnie Tyler.
Mm-hmm.
Mick Hucknall. Van Morrison. Brian Blessed. Of course, we all know about Jade Goody with her cervical cancer.
Yeah.
George Harrison with throat cancer. Charlie Watts. Do you know who Charlie Watts is?
He's the drummer of the Stones.
That's right. He had throat cancer as well.
Ah.
And of course, Dusty Springfield, who had breast cancer.
Yeah, wow.
So you're in very good company.
It just shows you, but I mean,
there's actually a few singers there as well. So I don't know what you're doing there.
But I noticed a few of those were several years ago.
Oh, yes.
And this is before, certain research had been done into the drugs they've got now, isn't it?
You're going to tell us all about the research, aren't you?
I am, because I didn't realise how much research goes into this.
Bless you.
Thank you. So the approval, there's a new breast cancer drug available called, and this is where they get big, the words, Pat, capivasertib, right?
Yeah.
And the approval of the breast cancer drug, capivasertib, this year was a result of 2 decades of research by all the scientists at the Royal Marsden. So 20 years.
I was going to say, that's nearly 20 years.
Yeah, it is. But it's amazing that, they're going to take this drug now, and 20 years ago they thought about something, that might sort of work. But there's 1, 2, 3, 4, 5, 4 long-term phases where you have to go through first with it. And I'm on one of these phases with my drug, you see. It'll be quite interesting to know which phase I'm on.
How old is your drug?
Well, it could be 20 years old, couldn't it?
Yes, that's a new drug that's 20 years old.
Yeah. No, it's a new drug, but it was thought of 20 years ago.
Yeah.
But I suppose my drug was tweaked because the other one that I was on, um, you know,
Lorazenib even.
yeah, the loratinib. Yeah, I'm glad you remembered it because I couldn't remember it. Um, yeah, so that was thought of, and then I suppose along the way they've tweaked it, and that's why they've got this sister drug. But so the development of this capiversity it began in 2000,
Right.
25 years ago, when pioneering research at the ICR focused on understanding of the AKT protein. And the AKT protein helps cell grows and survive, and blocking it can stop or slow down the cancer growth. So, and in 2002, so we've moved on a bit, scientists at the ICR discovered how AKT is activated and how it drives cancer. This breakthrough made it possible to design drugs that blocks its function. So, working with biotech company Astex Pharmaceuticals, the ICR identified a promising group of a candidate drug that inhibit the AKT. So these were then licensed to the pharma giant AstraZeneca, which we've all heard of, which developed them further and eventually created capiversitin.
See why some of these drugs are really, really expensive, because 20, 25 years in development
I know,
till the drug is actually available.
but it must be, they're making the drug and then they add a little bit of this and they, take a bit of that away and then it's just the
It's
precision
like the
of it
Great
all.
British Bake Off, you know.
I know, but how else do they make these drugs in?
Well, I don't know. That's more using them. I don't know. Don't ask me. I'm not a doctor. No,
Yeah,
they
so I do believe.
test and tissue and all that sort of thing. And
Because they don't test on animals now, do they?
I don't know.
No, I don't. Well,
But
they're
they're
testing
testing
on
on
me.
you.
I got him first.
Yeah.
So from that, you go to phase one. So,
Yeah.
and that's the first in-human trial. And
Right.
clinical trials, they usually have four phases, which I mentioned. At phase one, the treatment's tested in human volunteers for the first time, typically involving 20 to 50 patients. So that's not many, is it?
No.
I don't think I'm in this one for my one. I think I'm a bit further advanced. They aim to assess the drug's safety and determine how it behaves in the body and establish a safe starting dose. So, and in 2010 now, so we've moved on a decade, capiversitin entered the clinical trials led by the Royal Marsden and the ICR, where the Joint Oak Foundation drug company specialises in early phase testing of the theories for many different types of cancer. Results showed the drug was safe and could slow down tumour growth, so that's good. And in several cancers, particularly in patients with mutations in the PIK3CA, AKTI1, or the PTEN genes. So, and don't
I
ask
give them
me.
a name.
I know. Yeah, well, my drug was given a number first of all, and now it's got a name. But don't ask me to say it because
Right.
I'm still practicing it.
Yeah.
So that is a decade on.
So I wonder if you said they 20 to 50 patients go on this drug. I wonder if they. I don't suppose this is a place where they'll use a placebo, is it?
Do you know what? When I was reading up this, because obviously I've read this in a book, when I was reading about it, I was actually expecting the word placebo to come up somewhere.
Yeah.
But then I thought it's such a big thing with treating people in their lives, isn't it? With cancer.
Yeah.
So I thought no, perhaps I won't read it, but and I didn't.
No.
So
No.
there is no placebo effect. Isn't it funny? I'd heard of that word, and now I know what it means, and we've done it in the last two podcasts.
Yeah.
So
That's quite a common name.
yeah, I know. I had heard of it, but I'd never
Anyway.
really understood it. So I don't mind admitting that.
So are we
But
moving on to phase two?
yeah, we're moving on to phase two now, evaluating the effectiveness at this stage. A trial usually involves more participants now and aims to learn more about the treatment's effectiveness and side effects. Encouraged by the early results, researchers continue testing capiversitin both on its own and in combination with fulverescent, a hormone therapy. And this combination was particularly explored in breast cancer with AKT gene mutations. So the work's now led to the launch in 2014 of phase 2 Faciton trial, which showed that the drug combination doubled the time patients lived without their cancer worsening compared to fulverescent alone.
Right.
But anyway, with this fulverescent, the two together and working, so one on its own wouldn't have worked.
No.
So this is another thing that they're doing in the research, and they found that out in 2014.
Yeah.
So we're moving further on, aren't we? So we've got 2 more phases to go. Phase 3 is where you get the large testing, and I think this is where I am on my little journey. I don't know, but I'm just guessing. So following the success of the research into capivasertib, it progressed to the phase 3 in 2020.
Yeah.
So we're moving on again, and these trials are much larger. They often involve hundreds or even thousands of participants, and they usually compare the new drug to the standard treatment and are randomized to ensure fair comparisons. The goal is to confirm that the new treatment is as safe and effective as the current options. And led by the Royal Marsden and the ICR, the phase 3 Capitello 291 trial involved more than 700 patients with advanced hormone receptor, HR positive, that means, human epidermal growth factor receptor 2, HR2. There's all these numbers, aren't there? Negative breast cancer, the most common form of the disease. So the results revealed that the combination of capivasertib and fulvestrant outperformed fulvestrant alone, especially in patients with genetic alterations in the P13K pathway. So we've moved on to 2020. The combination's working, and then they move on to phase 4.
And it's as clear as mud.
It is as clear as mud. I'm to a medical expert.
I'm glad somebody understands it.
I'll tell you what, my nephew will understand it. He'll always understand it.
I thought you were talking in German code there for a minute.
Yeah.
Right, let's get on to phase 4.
I'll make the last one easier to understand, all right? So the long-term monitoring. So this is after it's been approved. And so once the drug's been approved, phase 4 trials involve monitoring its long-term safety and the real-world effectiveness and any rare or delayed side effects. And in June 24, last year, isn't it? These trials enabled the Medicines and Healthcare Products Regulatory Agency, the UK Drug Safety Body, to approve capivasertib in combination with fulvestrant. And in April this year, the National Institute for Health and Care Excellence allowed capivasertib to become available on the NHS. It means patients with HR positive, HER2 negative breast cancer, and who have mutations in the PIK3CA, AKTI1 or PTN genes, and whose disease has progressed following early hormone treatment can benefit from this drug. And this approval marks a major milestone in personalised cancer treatment and offers new hope for all the patients with advanced diseases. So,
you know what I've got to say about all that, don't you? OMG, LOL, 1, 2, 3, 4, 6, 6, 7. There's a lot of numbers and letters in that.
I know. But I just found it interesting to read, all that. And I suppose I could have just said that these drugs only take 20 years to go, but I didn't. So
that's the roundup on the Royal Marsden then, and its clinical trials on cancer drugs.
Yep.
So perhaps you'll find out from your team what phase you're on, because that would be interesting.
Yeah, it would be actually. I'd like to know, and I did ask, and one of the doctors said they didn't know.
Right.
So, but whether they wanted to give me that info, I don't know. I will keep you informed on what stage I'm at, and also how my scan goes.
So, what have you got on your phone you want to tell us all about?
Well, feedback from our podcasts. Yeah,
really?
I've had some feedback from people, which is fantastic, and we encourage this, don't we?
Yeah.
So the first one, hey Martin, Great podcast on weight loss, Jabs. Just listen to the latest. As feedback for you, although I was already thinking about it, your podcast inspired me to start a course on this subject. So he's actually listened to the podcast
I
and
love the way you say he's actually listened to the podcast.
yeah, all the way through. So
Yeah.
what he's saying is, so your podcasts are making a difference to people. So keep up the good work.
Oh, excellent. That's good to
So,
hear.
yeah, well, it is nice to hear people's feedback, and we
Well,
we do encourage it, don't we?
we don't personally recommend anything that anybody says on this podcast, but we provide the information, and it's up to you to make your own minds up. But
Yeah.
Karen's story was certainly inspirational in my view. I don't know how you thought.
Oh God, I think it was. Yeah,
How did Linny react to that?
she actually said it's a brilliant podcast.
Right. And did that change her views on taking the injection again?
Oh no, she wants to take it,
Right.
but I don't want her to because I think she's got a lovely figure as she is. But
But would she
she'd always
be
think
taking it with professional supervision, or will she just take it as she has been?
she would just take it on her own now.
Right. Okay.
I know she will, which we wouldn't advise to anybody, would we?
No, but there you go. Everybody's different.
Yeah. I've also had some other feedback about this the Manjaro.
Yeah.
So it was, and someone wrote, interesting podcast. One important negative to these drugs is that 25 to 30% of weight loss is muscle mass. If you are over 50, it's virtually impossible to rebuild muscle, and muscle is one of the most important things for longevity, to prevent frailty in old age. The irony is that when people put the weight back on and get back to their old weight, which most do, they'll be relatively fatter than before taking the drug.
Right. That explains a lot.
So,
Has that come from a clinical professional?
yes, someone who I know's worked in hospitals for several years and is also a fitness fanatic.
Mm-hmm.
So he knows all about hormones and you name it and everything like that. So yeah, he's very up on it. But it's interesting, two different sides, isn't it? One says, "Yeah, I'm definitely going to go for it," and the other's saying, "Be careful,
Yeah.
because in old age it could come back."
It's very personal. And I think, as we say, find out as much as you can. And if you are proposing to go on it properly. Do it with assistance and guidance from a professional.
But we don't know enough people who have been on it to say how much weight they have put on, really, do we? If they do go back.
Well,
If it does,
the other thing is it would be interesting to have a guest who's been on it and had a negative response to it.
yeah.
So we get both sides of the story because,
That's true. That's true. But what I'm getting at is this is new now, isn't it?
yeah.
So we haven't got someone 10 years in the future to come back and say, like, that second message said that you put all the weight back on.
I
But
was under
it'd
the
be-
impression that this drug was quite old and given to diabetic patients. But when I've done a bit of research, I think it was actually developed around 2022.
Oh, okay.
So it's not actually that old, but it was developed for the treatment of diabetes.
Mhm.
And the unknown side effect of it was that it helped lose weight.
Yeah.
Patients lose weight. So that's why it suddenly hit the slimming world sector, in storm.
Yeah.
So anyway, so there you go, Martin. Before we go, I must ask you, have you got a joke of the week?
Have I got a joke of the week? This is one of the
I don't know,
best
have you got a
jokes.
joke of the week?
Yeah, this is one of the best jokes I'm
I
ever
just
going
asked
to
you
tell.
that. This is one of the best jokes.
This is one of the best.
Is it? Here we go
Yeah.
then. So
I think we ought. I think we ought to go back to having. We used to have a little bit of music before it come on, and then a little twinkling bit.
yeah, it did build you up a bit, didn't it? But
Yeah, I think this one definitely needs building up.
does it right? Okay,
I think
well, we'll
you
let
need
our
to
listeners
add it.
decide.
Introduce it then.
I think they're dropping off as we speak. But there you go. Ladies and gentlemen, welcome to Martin's Joke of the Week.
Well, do you know what? I've just changed the ringtone for the alarm on my phone. I've changed it to the Okey Cokey. It took me an hour and a half to get out of bed this morning.
Oh dear. The best joke so far. Well, I don't know.
I thought that was good.
Yeah.
But it's a visual thing you got to imagine. I'm putting my left foot in, my left foot out. See, you're laughing now.
I hope our listeners are laughing and not switching off for good, but there you go. Everybody asked for it. Martin's joke of the week. There it was. Be it on your own head, so I hope you enjoyed it.
Yeah. What have we got in store for our listeners? We ought to let them know. We've got a model coming on who's going to talk about her breast cancer. We've got someone, we've got a gentleman who's going to come on and we're going to talk about erectile dysfunction, aren't we?
We are.
Which might be a good subject for a lot of men to listen to. And we're going to go to a cafe, aren't we?
That would be nice.
Yeah, where the people with learning difficulties are actually making the coffee and serving it all, and it's a great idea. And we've been invited to go down there.
Excellent.
So we'll look forward to that. And
that's your diet shop then. Yeah.
By the time we get there, I might have reached my goal weight. Because he's letting the cat out of the bag now. Everybody, I'm on a diet, and my wife is very good. In fact, I'll be truthful. I asked my oncology team if I could have the Manjaro jab. Now, I only asked them if I could have it. I didn't say I wanted it. So I'm waiting to find out. The pharmacist has contacted the company who make the drug. Yeah. And they're going to get back to the bloke at the Royal Marsden, the pharmacist. So I'm waiting on that one, but I'm not going to have it. I'm just going to cut out my cakes.
I reckon your tune may change if they come back and say, "Oh, Martin, we've had the results back, and yes, it's perfectly okay for you to use Monjaro if you want to, and you'll be in the fridge nicking Linny's Monjaro, and that'll be in there like a shot." Well, it will
apparently
be a shot.
that box in the fridge is not Linny's Manjaro jab, right. Which I thought it's my one for insulin if I collapse. So I wouldn't. So if I collapsed here on my own, I'd have just laid on the floor. Now I know it's in there, but with my memory, I'll probably forget.
But if you collapse, you're still going to lay on the floor.
I know.
You ain't going to be.
Yeah, I know. But at least I could
fridge.
Drag myself to the fridge. Yeah. So probably have a cake out of the fridge. Yeah. No, we don't buy anymore. So just going to give it a go. I've lost £3 since Sunday.
Yeah.
And that was with one naughty day going to London.
Right.
Because obviously, I nibbled at things and I, had a packet of, I don't know, not crisp, but, and then I had another packet and then I had a Kit Kat. It's just boredom really that you're eating, isn't it?
Yeah.
So it's keeping your mind occupied, which...
Jolly good.
Okay, mate.
Well, you take care.
Whet the listeners' appetite with a few things we're going to do in the next couple of weeks.
Yeah.
And we'll speak soon.
Okay, mate. Take care.
Cheers, then.
Good. Thanks, everybody.
Bye,
thanks for listening.
Thanks for listening, everybody.
Bye.
Bye.
You've been listening to the Who's Tom and Dick podcast with your hosts, Martin Weavers and Patrick Mortimer. If you enjoyed this episode, please subscribe to the show on Apple, Spotify, or your favorite streaming platform. New episodes are available every Friday. Thanks for tuning in.
Years go by, but the bond stays true. Through thick and thin, always breaking through. They'd reminisce under the old oak tree, sharing secret dreams. Just Tom and Dick, you see. Old mates, forever in sync. Stories to tell and a drink to link. Through laughter and tears, we rise and we fall. Every moment together, they cherish it all. Tom